Good morning. This is Dr. Bill White again, and I'm going to try doing some videos here where most of it will just be talking to you, and I want to do something on the causes of dental malocclusion or crooked teeth, and not just crooked teeth, but it goes into everything. Like you can't breathe properly, then that causes many other things to take place. And there are three main causes that there's probably some others that I could come up with here, but one of them is lack of airway development. And this is caused by lack of nursing. I'll go through some stuff here in just a minute. That's the main one I want to discuss. And then the other one is the marrying inter-race marriage, where you get a person with a large facial structure and marry somebody with a little thin face, and then the person with the thin face might get the enzymes and everything, but they will get the tooth from the larger face person. And then you're trying to put these teeth into this small facial structure, and they just don't fit. And so it is ridiculous to say that we never take any teeth out, or if you want to, of course they were taking out the wisdom teeth, they crowded everything up, so it's ridiculous. You need to reduce the teeth in the size, where you take a big tooth and go into trying to put it in a small facial structure. It just won't fit unless you just blow the facial structure really forward, have it protrusive out there. And I remember one time I had this Chinese lady, and she had a nice facial structure, but I was having to work on her, and she said, she brought me some pictures of her aunts and folks in China, and they were protrusive. She said, I want to have this, I want you to do my orthodontics, and I don't want my face protrusive. So we had to take out 4 first bicuspids on the case, and we closed it and everything, and she looked nice. So teeth should be removed in some cases, but it's pretty rare, much more rare than it used to be. All right, then the other deal there is allergies and things that we have. Pollution in the air causes mouth breathing, and that causes the malocclusion. So first I want to go into the cause and tell you something on the one about breathing, mouth breathing. And this happened to me in Nigeria, where we were, my wife and I went as dental missionaries there. We lived in Baden, Nigeria for about 1.5 years. And this little, it was not a small town, but it had a lot of people in it, and there was a school there that the church worked in, and it was a pretty good sized school. And I went there, they wanted me to come and bring this staff. I had a real active staff in the clinic there in the Baden, and I took they were all young men. We didn't use any women. I'm not saying that against women. We had all women over here nearly. That's okay. We cleaned all of their teeth, and if they had a cavity, I would fill the cavity. I was off in another room, and had one of the guys helping there too. And I filled all the cavities in that whole school, and there was a lot of people in there, and I did only 13 cavities, or maybe it was 12, I was kidding. And I was amazed at it. But these people never ate anything sweet. They wouldn't know what it tastes like to have a piece of pie. They probably wouldn't even like it, you know. And they had never eaten stuff. But yet you take these people, and if this was a British colony, and if they went back to Britain where they eat a lot of candy and sugars, they would develop cavities too. So that was a cause of malocclusion in there. Now, this whole school, I did all the orthodontics in the school too, and there was only one person that had a supernumerary tooth that we took out. Every one of the kids that I saw out there, and some of them were like 12 and 14 years old, they had protrusive faces, they were broad, and they had large teeth, and they all fit together, and the malocclusion just didn't exist. And I couldn't imagine, here in America or any other developed countries, there's all kind of malocclusion going on. But none of these kids had any protrusiveness or malocclusion or crossbites or all kinds of things like that. They all had straight teeth. They were full-faced and everything, and the teeth fit the person. And the person had a lot of, they didn't have a lot of problems with their mouth breathing and everything else. And I got away from there, and I didn't have a camera to take all these pictures of these people. But I kept thinking about how on earth did this whole school have no malocclusion to speak of, and it just floored me that I could not imagine some school like that with no malocclusion. Then I learned later that the Nigerian people, and this is maybe in other African places, they nurse the children for about 2.5 or 3 years. They say about 3 years. These children would nurse their mother. They ride on the back of the mother, and they're with the mother, I guess, pretty much all the time. And if this child doesn't get 3 years, or about 3 years of nursing, he would have a problem. In other words, the mother had another child, got pregnant, say a year after this one was gone, and then about a couple of years had a baby, or less than that time, then the baby got the nursing milk, and the older child got none. He would have to live on other things, and it was a very little or no protein that they got. And these children would have a huge stomach. I mean, I had a picture of one, but he was so embarrassed he went the other direction, and I shot a picture of him from the backside. I was kind of embarrassed and wouldn't want to tell him. Of course, this young man died of this thing. The Africans call it the younger kills the older. And so the mothers go back to their village or whatever it is, and they don't have any relation with the father or anybody else for about a little over 2 years, and then they can have another child, and the first one will get enough protein in the foods that the older kids eat to do all right. Now, I figured out that you cannot nurse and breathe through your mouth. I don't know how you would do that, but I've just not had any study on that, but you cannot breathe through your mouth while you're nursing, and that must be true. And so these children develop an airway really good from constantly using that airway and developing it. And when the child doesn't nurse, many of them, if they don't nurse very long, even if they get plenty of protein and everything else, their maxilla, or the area where the air should be, does not develop good. And I've had dentists talk with me and things that wrote articles and had all kind of knowledge on orthodontics, wondered why we had so many kids with cross bites. In other words, their jaw would be off to one side like that. And I didn't tell this young man the reason. I said, well, you tell me why we're having so many cross bites in developed countries and everything. And so I went along for a while, I told him later what it is and what I believe it is. And it is that children do not nurse sufficient time when they're young, and they miss some of the enzymes and resistance to bacteria and other things that these other children do, and they develop their airway. Now you think, well, just breathing air through there doesn't make this thing go bigger, but it doggone sure does. The pressure of the air coming in and out of the airway develops that airway, and also the nursing in a position and all this stuff develops the airway. And so when the airway is good, the child breathes through the nose. And breathing through the nose has a whole stack of benefits that you don't get. Now this is just one area of malocclusion. We have oversized one pair to another being small face, and then we have things that are allergies from the pollution in the developed countries where that causes it. But the main one I wanted to talk to is about nursing. Now, it's impossible for the American women or any country around now for them to nurse a child for that long a time. It just wouldn't do too good here. And I don't know, maybe we can come up with something that children can do, and the way they nurse, get a bottle that's where they would nurse for hours, and the facial structure would develop, and that's all that I can figure out why these children in Nigeria at that particular school had no malocclusion. The whole school didn't. Now, they didn't have cavities because they literally didn't need any sweet stuff. So these are things that we have to think about is the cause of this. Now I'm going to do 2 or 3 videos on the cause. I can't cover it all in just one video, but that is one of the big causes of malocclusion. Now, if you develop crossbite, in other words, the mandible has the tongue in it much of the time. If you're breathing through your mouth, you have to put your tongue in the bottom arch between the jaw here. And so the lower arch will expand more and the upper arch, if you swallow correctly, gets pressure from the tongue, and it expands the upper arch, and that's where your airway is. And if you don't get that, then the lower jaw is spreading out further. And I'm a moderate mouth breather, and my lower jaw is too wide really for my upper teeth, and so you tend to break, the teeth don't meet together good. I'll see if I can draw the teeth when you have a lower upper tooth like that, and if the lower tooth expands too much, then the cusp of the lower tooth would come right and touch like that. And this way, if your upper teeth don't come over the lower teeth, you'll bite your cheek in here. And I have that problem, and I also have not developed the maxilla like it should be, so I have to take a lot of things for the fact that I can't, I have allergies to many things. Now, this is one of the main causes, I think, of malocclusion, and that's lack of nursing or lack of developing the airway like it should be. And so the maxilla gets smaller, and it gets even worse as it gets smaller. It can't produce the, give the air plenty of room in there. And this is a kind of a basis for the malocclusion that we have today. And I had no camera to take pictures of this, so you just have to take my word for it. And the kids developed and had a good airway, and they breathe properly. Now, if in the United States and stuff where we breathe through our mouths much of the time, and if you breathe through your mouth, your lower jaw will widen out more than your upper jaw, and your upper jaw doesn't get that pressure of the tongue, so it gets narrow, and then you can't breathe in it. After you get older, you can't breathe enough, and so it gets even smaller in relation to the lower jaw, and that develops crossbites. They can be a unilateral crossbite, it can be a bilateral, or just be on one side of the mouth. And if you notice people on TV, they may have beautiful teeth, and a lot of them, if you look at their chin, it'll be off to one side or the other. And those people develop this when they're very young, and so the condyle and the TMJ, or temporal mandibular joint up here, will shift. In other words, if you chew to one side all the time, then this joint up here gets further out, and this one goes further back. And a lot of times this has an effect on the TMJ pain, or stuff that people come in with the pain from the joint. And this can have some association with TMJ pain. That's not a big problem with it. I may talk some more about the cause of TMJ pain. But this is one of the main reasons for the jaw shifting and the upper too small. So you have to, if you get a child in that has this problem, that are mouth breathers and everything, you've got to work on restoring the airway like it originally should have been. And so we put palatal separators in all these children and separate the sutures and broaden it out where the upper teeth kind of fit over the lower teeth. And this has to be done early. If you wait around till the child is 12 or 14 before you work on them, and that's, some people don't mess with the problem here until they're about that age. You've got to get in there real early and do a two-phase case and spread that maxilla out and the airway good on that. So I'm going to stop on this, and I'm going to come back on causes of malocclusion. And if you don't get to the cause of the malocclusion, and you correct something, but you didn't get to the cause, you just patched up the thing, and you're going to have trouble with retention of the case. If you leave that undone, I've shown some video, I think, on where we didn't get at the real cause, and it will relapse on you. So I hope this will help you in your doing orthodontics, and we'd like to, people all over the world can belong to the American Orthodontic Society. You let us know and we'll send you the information and everything of how you can do that. And I appreciate you coming and listening to this. I hope it'll help people wherever it's heard. And I'm going to say goodbye, and we would like for you to join our group and subscribe to our channel. So I'm going to sign off here. Thank you a lot.